friends, and my audience. This is Dr. P.M. Sohal, Associate Professor, Department of Nephrology, DMC Ludhiana. I will be talking about a much talked about topic called anca vasculitis and anca vasculitis related glomerulonephritis. This disease is an immune mediated disease in which pathogenic antibodies known as anti-neutrophil cytoplasmic antibodies act against the neutrophils, leading to degranulation and inflammation and injury. It is marked by disease in the kidney, disease in the skin, disease in the brain, disease in the muscle, disease in the joint, disease in the parietes, and disease in the heart. In the kidney, the disease is known as glomerulonephritis, meaning inflammation of the smallest capillary units in the kidney called glomeruli. The clinical manifestation of this disease is in the form of red urine, red blood cell cast in the urine, creatinine starts rising. There is serial stepwise rise in serum creatinine, which is subacute. It is not very acute rise. It occurs in days, weeks, and months. Most of the time, patient present late. At that time, the serum creatinine is generally more than 5 and there is practically nothing that can be done and salvageability is poor. These cases progress to end-stage renal disease requiring dialysis or transplantation. Extrarenal manifestation of anca vasculitis is in the form of arthritis, rash, ulcers, bullae, alopecia, ulcers in the mouth and the nose, CNS involvement in the form of stroke, epilepsy, or headache. Also, involvement of the heart in the form of myocarditis, endocarditis, involvement of the lung, which is predominant in one type of anca vasculitis in the form of nodules, and finally nodules once their necrose give rise to small cavities. There can be interstitial lung disease also. Involvement of the GIT leads to anorexia, nausea, vomiting, pain in the abdomen, subacute intestinal obstruction, or sometimes perforation. Involvement of the muscles leads to muscle weakness and muscle pain. Involvement of the eye sometimes can lead to redness in the eye. One kind of disease has predominant ENT involvement where there is ear discharge, perforation in the ear, conductive or sensorineural deafness, or these patients can have saddle nose or crusts or epistaxis. Diagnosis is made by testing for these ANCA antibodies, or diagnosis is made by doing a kidney biopsy, which generally sees crescentic glomerulonephritis, fibrinoid necrosis, and signs of inflammation in all the three compartments: glomerular compartment, interstitial compartment, and small vessels, that is the vascular compartment or vasa recta, also known as angiitis. Treatment of this condition is very special. It requires multidisciplinary approach. If the presentation is like rapidly progressive glomerulonephritis, then steroid pulse along with either rituximab or cyclophosphamide and or plasmapheresis given as induction treatment for 3 to 6 months. If there is improvement, then maintenance treatment for 3 to 5 years consisting of either rituximab maintenance or mycophenolate maintenance or azathioprine maintenance. With good treatment, almost 90% of the patient recover good function, 10% go on to develop end-stage renal disease. Most type of mortality is due to infection, which is related to use of high dose of glucocorticoids. I hope this much information has been given to you was very useful. Please subscribe to my channel and please subscribe and share this video with others so that this information is spread. Thank you very much.